Connecticut is launching a new program next month designed to save you money on medication, up to 80% on certain ones. It's made possible through a prescription drug discount card, which is completely free and all state residents are eligible for. Joining us to talk details is Republican State Senator Tony Huang, who is a ranking member on the Insurance and Real Estate Committee. Senator, thank you so much for joining us this morning. Always a pleasure speaking with you.
It's a pleasure, and good morning, everyone.
Good morning. So give us an overview of this program. Why is this good news for people who do rely on prescription medication?
Well, ultimately, prescription drugs are unaffordable and unsustainable for many Connecticut residents. This is a program that the controller has negotiated in conjunction with 3 other states, Nevada, Oregon, and Washington, which will look at being able to use this card where 98% of the pharmacies across the state are going to utilize it. Savings will range up from 80% on generics and 20% on brand names, which is an important and critical cost savings. But there are some caveats to this. Residents will not be able to use their health insurance card and their discount cards at the same time. And unfortunately, despite being available to everyone, officials really said that this is aimed at 3 groups of people: those on high deductible health plans, the uninsured, and those seniors on Medicare, in which prescription drugs have really outstripped their ability to have deductibles and pay. And those people using this program, the money that's being used will not count toward their deductible and out-of-pocket cost measures. So there are caveats to this, and the reason for this is really just trying to help people that drug costs are truly unsustainable, but despite being essential.
And you mentioned that point of high healthcare costs. Are there discussions to possibly expand this at all? Do lawmakers need to do more on this issue as they get back to session this year?
Absolutely. You know, this is a great start, but we have to do much more, as evident by the health insurance rate increase for individuals and small business that just passed out last week, in which there are almost double-digit increases on compounding of what has happened for the past 10 years. One measure that we're going to look at is looking at PBMs, which is pharmacy benefit managers. They carve out as a middle person who negotiate drug prices on behalf of insurers. They decide which drugs an insurance plan covers and how much they pay for it. And a recent lead with this is that the Wall Street Journal came out with a study that a cancer drug Gleevec went generic in 2016 and can be bought for as little as $55 a month. The many patients under insurance plans such as CVS and Cigna are paying more than 100 times that. So it's a real issue that we have to consider in regards to PBMs, how we manage prescription drug costs. Another factor that's a real concern is the vertical integration. Those PBMs are mostly owned by the health insurers themselves. So that's something we're going to have to explore more. But ultimately, I'm going to leave you with this. This is a small incremental change that we're making on healthcare costs, but we have so much more to go because it's truly unaffordable and unsustainable on the residents of Connecticut.
The numbers you mentioned really tell the story here, an issue that lawmakers will address as they get back into session. Senator, thank you so much for joining us this morning. Really appreciate your time.
Angelo, thanks for having me. Have a great day.
Quick heads up for everybody out there. If you are interested in this discount card program, you can fill out an online form that's starting on October 2nd. We do have the link to do that on the links page of our website. That is fox61.com. Let's get you over to meteorologist